Every 40 seconds, someone in the United States dies from heart disease. Heart disease is often called a silent killer because many people don't even realize they have it until it's too late. In this video, we're going to reveal the often overlooked signs of a heart attack. Let's dive in and empower you to take control of your heart health. We've all seen the movies where someone clutches their chest dramatically and then collapses from a heart attack, often in a very sudden and dramatic fashion. But in reality, heart attack pain can be a lot sneakier and more subtle than that. Imagine this: you're feeling a tightness in your chest, like someone squeezing a little too hard, making it hard to breathe. It might even feel like heartburn or indigestion, making you want to reach for the antacids, thinking it's just something you ate. And the pain doesn't always stay put in one place. It can radiate to your arms, especially the left one, making it feel heavy or numb. You might feel it creeping up your neck, into your jaw, or even between your shoulder blades, causing a dull ache or sharp pain. If you're experiencing any kind of chest discomfort, especially if it's new or unexplained, don't wait or ignore it. Get to a doctor and get checked out immediately. Early detection can make a huge difference. It's always better to err on the side of caution when it comes to your heart. Your health is too important to take chances with. Pay attention to what your body is telling you and get the help you need. Remember, your heart health is in your hands. We've all been there. You're winded after climbing a flight of stairs trying to catch your breath after a brisk walk. But what if you're suddenly short of breath doing everyday activities, things that never used to bother you? Shortness of breath, especially when it comes on suddenly or worsens with exertion, can be a red flag for heart trouble. When your heart isn't pumping efficiently, it can't keep up with your body's demand for oxygen. This can leave you feeling breathless, like you can't get enough air no matter how deeply you breathe. So if you're experiencing shortness of breath, especially if it's new or unexplained, talk to your doctor. They can help determine the cause of your breathlessness and get you on the right track to better heart health. Let's talk about those moments when your body sends you a signal that something's just not right. We're talking about cold sweats, those clammy, uncomfortable episodes that can leave you feeling like you just stepped out of a cold shower. When cold sweats come out of nowhere, unrelated to your emotional state, it's time to pay attention, especially when they're accompanied by other symptoms like chest pain, shortness of breath, or nausea. Cold sweats can be a sign of many things, from a simple cold or flu to more serious conditions like low blood sugar or even a heart attack. So if you're experiencing cold sweats, especially if they're persistent or unexplained, talk to your doctor. Remember, your body is pretty amazing at sending out warning signals. It's up to you to listen and take action. What do you do when your stomach sends an SOS? Nausea and vomiting are no fun, and they can be caused by a whole host of things, from a stomach bug to food poisoning. But did you know that nausea and vomiting can also be signs of a heart attack? When they're accompanied by other heart attack symptoms like chest pain, shortness of breath, or cold sweats, it's a whole different story. During a heart attack, the blood flow to your heart is blocked, and this can trigger a cascade of symptoms, including nausea and vomiting. So if you're experiencing nausea or vomiting, especially if it's severe or accompanied by other heart attack symptoms, get to the emergency room immediately. Every minute counts when it comes to treating a heart attack. Ever feel like the room is spinning even when you're standing perfectly still? That feeling of lightheadedness or dizziness can be disorienting and even a little scary. When lightheadedness or dizziness comes on suddenly, lasts for an extended period, or happens frequently, it's important to take notice. When your heart isn't pumping efficiently, your brain might not be getting the oxygen it needs to function properly. This can lead to feelings of lightheadedness, dizziness, or even fainting. If you're experiencing dizziness along with other symptoms like chest pain, shortness of breath, or irregular heartbeat, it's crucial to seek medical attention immediately. Even if you're not experiencing any other symptoms, it's always a good idea to talk to your doctor about persistent or recurring dizziness. Ever felt like your body's battery is drained? It's a feeling many of us are all too familiar with. We all feel tired from time to time. It's a natural part of life, especially after a long day or a restless night. But what if you're constantly exhausted no matter how much sleep you get? What if every morning feels like a struggle to get out of bed? What if you're dragging yourself through the day, feeling like you're running on fumes? This isn't just about being a little tired. It's about feeling completely drained. This kind of unusual fatigue, the kind that lingers and interferes with your daily life, can be a sign that something's not quite right. It can affect your work, your relationships, and your overall well-being. When your heart isn't pumping efficiently, your body's cells might not be getting the fuel they need, leaving you feeling drained and depleted. This can be due to various reasons, including heart disease or other underlying health issues. So, if you're experiencing unusual fatigue, especially if it's new or persistent, talk to your doctor. It's important to get to the root of the problem rather than just pushing through it. They can help determine if your fatigue is related to an underlying medical condition like heart disease and recommend the best course of action. This might include lifestyle changes, medication, or other treatments. Listen to what your body is telling you and don't ignore those signs of fatigue. Your body has a way of signaling when something is wrong, and it's crucial to pay attention. You deserve to feel energized and ready to tackle whatever life throws your way. By addressing the root cause of your fatigue, you can reclaim your energy and vitality and live your life to the fullest. Your heart beats to its own rhythm, a steady drumbeat that keeps your blood flowing and your body functioning. But what happens when that rhythm gets thrown off? What happens when your heart starts racing, pounding in your chest, or skipping a beat? When your heart rate speeds up or becomes irregular for no apparent reason, it's important to pay attention. If you notice any irregularities in your heartbeat, especially if they're accompanied by other symptoms like dizziness, shortness of breath, or chest pain, don't hesitate to seek medical attention. Your doctor can perform tests to determine the cause of your irregular heartbeat and recommend the best course of treatment. Remember, your heart is a vital organ, and it's important to keep it beating in a healthy rhythm. When your body holds onto too much fluid, it can lead to noticeable swelling, particularly in the lower extremities. Have you ever noticed your ankles or feet looking a little puffy, especially at the end of the day? This can be more than just a minor inconvenience. Swelling in your lower extremities can be a sign of fluid retention, which occurs when excess fluid builds up in your body's tissues. Fluid retention can be caused by a variety of factors, from standing or sitting for long periods to consuming too much salt. Lifestyle choices play a significant role, but it can also be a sign of a heart problem, especially if it's accompanied by other symptoms we've talked about, such as shortness of breath or fatigue. When your heart isn't pumping efficiently, blood can back up in your veins, causing fluid to leak into surrounding tissues. This can lead to noticeable swelling and discomfort. If your swelling is severe, persistent, or accompanied by other symptoms like shortness of breath, fatigue, or chest pain, it's important to see your doctor. These could be signs of a more serious condition. Early detection and treatment are key to preventing more serious health problems down the road. Addressing fluid retention early can help manage symptoms and improve your overall health. Making lifestyle changes such as reducing salt intake, staying active, and following your doctor's advice can make a significant difference in managing fluid retention and maintaining your health. We've covered a lot of ground today talking about the often overlooked warning signs of heart disease. From chest pain and shortness of breath to fatigue and swollen ankles, these symptoms might seem subtle on their own, but together, they paint a picture of a heart in distress. By understanding the warning signs of heart disease, you're empowered to take control of your health and seek help when you need it. If you're experiencing any of the symptoms we've discussed, especially if they're new or persistent, don't hesitate to talk to your doctor. And if you're experiencing severe symptoms like crushing chest pain, difficulty breathing, or loss of consciousness, call 911 immediately. Your heart is a precious organ and it deserves your attention and care. By arming yourself with knowledge and taking a proactive approach to your health, you can significantly reduce your risk of heart disease and live a longer, healthier life. Be sure to subscribe to XL Wellness for more helpful videos on how to live your healthiest life. Your heart will thank you for it.